We believe that big part of the health of the prevention comes with people like adjusting their lifestyle, adjusting their behavior towards different habits, in addition to the vaccination as well. It's a shared responsibility between the government, pharma industry, other players, and the patient himself as well or herself.
Welcome to the Health Beats podcast, brought to you by the inaugural Abu Dhabi Global Healthcare Week. The Health Beats podcast series is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We're giving you an insight on the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Lara Satrakin, and in this week's episode, I'm joined by Ashraf Mallak, the Managing Director for MSD GCC. Our conversation today is entitled How Public-Private Partnerships Are Shaping the Future of Healthcare in the UAE. Ashraf, welcome to the podcast.
Thank you. It's my pleasure to be with you, Lara.
Public-private partnerships are something that are very interesting to those who understand them and a bit foreign to those who haven't approached it. So let's just get started by understanding from your perspective, what are the critical factors that make public-private partnerships successful in healthcare? And just give us the general sense. How do they work? What makes them most effective? And any examples?
Sure. So, in my perspective, public-private partnership is beyond just an agreement of two sectors or two entities that have decided to work together. It's a strong reflection and a commitment towards a shared vision and mission to improve health outcomes and serve people and patients. To make this collaboration successful, it is essential for this shared mission to be clear and for the needs and desired of patient outcome to be in the center of the collaboration to ensure that the right solutions are being developed and that the right challenges have been addressed by both parties. At MSD, we collaborate globally with governments and concerned organizations in the ecosystem like WHO to understand the pressing unmet medical needs and to direct our efforts and clinical research towards innovative solutions. I believe at MSD we play a pivotal role in such partnership, and that's for many reasons. We're a leading company in innovation and patient solutions that address unmet medical needs, and everything is around unmet medical needs. And we're keen to bring our medicines and vaccines early on to our patients. In Abu Dhabi, over the past few years, we have had meaningful collaborations and partnership with the Department of Health of Abu Dhabi in different areas, were resulted in a clear impact for our people in Abu Dhabi, like healthcare data management and utilization, healthcare digital solutions, and how we can work together to advance outcome in clinical research. Those agreements are world-class agreements that were signed at the Bayou in the US.
So talk to me about these unmet health needs and how government and industry partner to tackle one of those unmet needs. Can you give me the anatomy of a public-private partnership?
As I have shared with you, Laura, that public and private sectors are aligned on the same mission, which is advance the welfare of our people and patients in the region and in UAE here. So we continuously work in collaboration to have a better understanding of the unmet medical need and better understanding of the patient journey. With that, we try to identify together the areas where we call them that actionable areas, where we can work together to further enhance those areas. There is multiple areas we have identified together. I would say that there is three clear main areas where we believe that we can drive a change here. Big area is like patient screening and early identification. Another area like patient awareness and education and patient access to treatment. Those are like the key three areas that we collaboratively working together on. For patient screening and early identification, we're running different programs in collaboration with the DOH, like outcome research and early patient identification, utilizing the state-of-art data available at Malafi Data Center in Abu Dhabi to look into different disease areas like cancer and potentially cardiovascular. If we come to the other area, which is patient awareness and education, we've been working actively together in this domain and with other stakeholders like Emirates Oncology Society and organizations like Friends of Cancer of Patients to raise awareness on different areas of cancer like lung cancer, breast cancer, and cervical cancer. With that, we have been proudly awarded with 2 awards. Patient Partner of the Year, that was in 2022, and Medical Education of the Year in 2023. Coming to the last part, which is really important, which is the conclusion of all of that, which is patient access to treatment. We believe that UAE sets a global role model when it comes to accelerating access to treatment and innovation. As we speak today, UAE is one of the first countries globally that register any new innovative treatment and vaccine just right after the FDA approval. This is a testament of the evolution of the regulations made and adopted by the decision makers in the UAE.
So the movement from trial to implementation rollout is faster in the UAE than elsewhere?
This is what we call the integrated patient journey, how you make sure that you identify the patient early on and you provide access to innovation early on. So this journey has been closed massively over the last probably 5 to 10 years.
Are there other ways that PPPs here in the Middle East are unique or remarkable compared to other parts of the world?
Yeah, definitely. It's all about co-creation here. That what we see differently here in the region, that this open dialogue and collaborative relationship that you have between the public and private, what we have uniquely here in UAE specifically, that before any decree that comes in action, they invite stakeholders like the pharma industry or insurance or medical insurance companies, other associations to sit on a round table to discuss together that what are the different perspectives of any decree or laws and regulations that will be released in the country. So, and what's he called co-creation. So they consider the different angles and different perspectives of any laws here, and they integrate those thoughts to make sure that when they come in action, they will secure like everyone is alignment to that. So this is really what has been very unique here in the UAE.
Closer consultation, co-creation, that is
Exactly.
indeed very different. In other parts of the world, is it
Exactly.
more adversarial? Do you feel the public sector and private sector here have a more harmonious relationship, somehow more productive relationship?
Yeah, versus other markets. Yeah, definitely. I would say this is a benchmark for other countries in the world, right? So where things most of the time are one-sided, and then you start to react to that. So in most of the cases, you see that the private sector reacting to the public laws and regulations, where here are co-created.
And they can make their views heard before legislation
Exactly.
hits. So how do public-private partnerships contribute to improving health access to healthcare services, especially for underserved communities and marginalized communities?
Yeah, that's a very good question. And I think this is the core of the global health equity efforts, right? So we are all aware that not all communities are the same, and you will still have big underserved communities in any country across the world. So how we can really work together to make sure that we can offer more support to those underserved communities, or we call them, in other words, vulnerable communities, right? So at MSD, we believe that we're one of the leading organizations that are trying to be proactive in finding solutions for the underserved or vulnerable communities. And we're committed to advance health equity across the globe. So I would say that 10% of our scorecard as we speak today goes to how much we contribute to the health equity across the world. So having said that, MSD has launched 2 major global initiatives for people of vulnerable communities. Number one is, I would say that the Fighting River Blindness in tropical areas of the world. Those efforts will continue to eliminate river blindness across the world. Another initiative that's we're real proud of for a vulnerable community, it's mainly for the female who go through the pregnancy and delivery experience. MSD collaborated with more than 40 NGOs across the world to improve the lives of more than 1 million women across 50 countries. In the same context, if I want to take this to the level of where we live here in the UAE, we clearly have some vulnerable communities when it comes to the communities who are less privileged financially, right? And when it comes to their insurance coverage. So here at UAE, we collaborated with the Ministry of Health. We signed a memorandum of understanding to launch a program with collaboration with the NGOs to provide support for underserved communities who are suffering from cancer, and for their limited financial capacities, they're not able to have a full coverage for the cancer treatment. The program called OWN, in Arabic, OWN, in English means support, where we make sure that we will find solutions to cover the treatment through MSD, the NGOs, and others to make sure that the patient will have an uninterrupted cancer treatment for different types of cancer.
It's a wonderful form of provision for those patients. As you look ahead, what trends do you anticipate are going to be the most significant, the most impactful on the healthcare industry? And how are the partnerships like the ones you described going to adapt to those trends?
The fact that we know, Laura, that keep many of us, especially the governments, up at night, the fact that as we move forward, the population will continue to grow and the disease prevalence will continue to grow. And the inflation that we live today, at some points, will continue to grow. With that, there's more financial challenges that will come, and those vulnerable communities will keep growing. So this is the fact that we are aware of. Right now, especially after the pandemic, we could really witness there is big trends that can reshape the healthcare landscape in different countries. And this is more focusing the public health and focusing on the prevention before that we think of the treatment. Again, I would say that UAE really set a role model in driving such efforts, in driving the public health across the region. Just 2 months ago, DOH, they released their new healthcare strategy, where you can clearly see that the public health comes in the core of their interest, and looking into different stages of launching the public health. They will start with the children, women, then they will go to the cancer patients, and this will keep evolving to the different communities. And with that, we've seen this is a great opportunity to collaborate with the UAE government and different stakeholders like Emirates Oncology Society and others to put together a national agenda around cancer. So we put together what's called NCCP, which is a National Cancer Care Program. In this, we integrated the perspectives and the effort of everyone to look into that, how we can work together to expand the prevention, the opportunities to prevent cancer before it happens. In that, we identified areas like screening, early identification, early treatment, fast access to innovation, and so on and so. And back to the very early question you asked me, that here, when you have a clear agenda, when you have clear responsibilities, you will see that every one of the ecosystem clearly understand what the part they will play to make sure that we will drive efforts for the public health of the people here in the UAE.
So it's interesting. I've never heard anyone make that connection. The trend in terms of population growth, obviously also aging populations, other forms of risks and shocks, actually points you and MSD to preventive care emphasis. That's interesting. Do you think that's the case globally, or is that something unique to here in this ecosystem?
This is globally.
Is that the answer? Yeah.
Yeah, this is a global direction, by the way, not only for MSD. I think this is global for all people who play a pivotal role in the healthcare industry. At MSD, we launched this in the US and Europe. And among the first countries in the region is UAE, where we can drive this national agenda around prevention. And when I say prevention, it's specifically about cancer prevention.
I mean, we're hearing this on many episodes of the podcast. Prevention here is a major, major priority, if not, it seems like the
Definitely.
driving impulse. Uh, how does the rest of the world come on board with this? We know in other parts of the world, people are calling it sick care, not healthcare. There's less emphasis, less systemic movement toward prevention. Having seen it work here, what do you think needs to happen in the rest of the world?
I think that big part of a prevention works through people education, right? So I think the efforts that the world is trying to drive is how to find the platforms, healthcare platforms, where people start to look into having a higher health literacy and get educated. And this way that you will see that they start to integrate those healthcare platforms within the social media channels. You can now look into Instagram, TikTok, Facebook, where people start to push some content to the public that focus on healthcare education, because we believe that big part of the health of the prevention comes with people like adjusting their lifestyle, adjusting their behavior towards different habits, in addition to the vaccination as well. It's a shared responsibility between the government, pharma industry, other players, and the patient himself as well or herself.
Ashraf, you've been in this region for a very long time. You're a pharmacist by background. How has this region evolved in terms of its approach to healthcare? It wasn't always this level of innovation. This is something that's really grown over time. How would you tell the history of that?
Over the last 2 decades, specifically the last decade, I can see that there is evolution in different areas that change the healthcare landscape in the GCC, specifically in the UAE. I would say that there's clear 3 areas where you can see the evolution has really happened here. The first is the laws and regulations, because the biggest driver to any change are the laws and regulations. The second one is the healthcare infrastructure. If we look at how the public healthcare facilities or the private healthcare facilities grown over the last probably 10 or 15 years, you can really realize that why in UAE there is an aspiration to consider UAE as the hub for medical tourism. If you look at the partnership have been done in Abu Dhabi, like Mayo Clinic, John Hopkins, Imperial College, Cleveland, and others, the same in the private sector. You really have like the world-class hospitals are opening across the UAE. So with that, you will see that there is an invitation for the top talent in the healthcare to come and work in the UAE. So I would say that this is the infrastructure that started to attract the attention for the healthcare sector in the UAE. The third one is the data, the wealth of data that we have. And with the data, you can unlock many opportunities. Now, Malafi is considered one of the best examples here. I wouldn't say even regionally, but globally, as all patient data are integrated in one place. Having such data, this will help to unlock data utilization in running clinical research, and running outcome research, and applying some algorithms and AI algorithms to identify the patient of the high risk of different areas like cardiovascular or cancer or others early on, and reach out to the patient before the disease could probably happen. So I think that those are the key 3 pillars that transform the healthcare sector in the UAE.
And this is over a decade, 20 years. When did this story really begin to pick up speed?
I would say that the seeds started like 15 years ago, 15, 16 years ago, and you start to get the outcome in the last 10 years.
So it's really interesting. You have this intentional drive to invest in the sector, to streamline things. And as you described earlier, this public private partnership identify the unmet needs and design the interventions together, consultative. It is definitely unique to this part of the world. I don't know that it works that way anywhere else.
I think different reasons to look at. Like first, you want to look at that how the agenda is designed. The agenda is designed in a way that where there's many panel discussion with the top healthcare leaders across the world to come together and discuss specific subject that matter for everyone in the healthcare sector. So it's really important to connect with such leaders, to listen to them, to listen to the debates, to listen to the discussion, because that aims at providing solutions to different stakeholders in the healthcare. On the other hand, there is the big exhibition where the major healthcare providers will exhibit and have their own stand there. And this will create a unique opportunity for different players in the healthcare sector to get together, to connect together, and discuss common solutions that could be of interest of both parties here. And definitely at the end of the day, this will help everyone to get to know what are Abu Dhabi plans in the healthcare sector and how you can join hands with the Abu Dhabi government to collaborate for the future of the people here in the region.
So everyone in the industry showing off their latest and greatest and connecting and talking and this
Exactly,
directional thing.
exactly.
This is big. So from your experience in the sector, what do you think are the biggest challenges facing global healthcare today?
Yeah, I think there's many challenges, but at the same time there is many solutions as well and many opportunities as well. Challenges that I think that there's no more barriers cross countries here, right? So we live in one globe. I think that the pandemic really was a clear example. So small event could start in somewhere or in small country could really impact the whole world. So any small thing could turn into a big pandemic. So this is one of the challenges. Having said that, this will really invite for a unified global public health plan. And this is what the government is trying really to work along with the WHO, trying really to replicate and standardize this public health across all countries, which is really challenging, definitely, because countries have different healthcare infrastructure, have different laws and regulations, have different capabilities, and so on. So this is one thing. Another challenge, I would say, that probably what we have discussed earlier, that this financial capacity, or I would say that affordability, will continue to grow as a challenge for many communities, and you want always to find a solution to address such gaps. Where I find opportunities here, this is what I would really like to close my response with, are the opportunities that the example that I have mentioned, having this data center in Abu Dhabi, this is really growing across the globe in many countries across the globe. Because we believe that if we unlock the potential of data, I think this will really help to address a lot of issues before they really happen. So I think these like massive solutions will really help to start, unite together to find solutions for the people here. Another one, I see that the concept of health equity is now being promoted across the world, and more organizations, countries across the globe trying to endorse this health equity and trying to be part of this. For example, last year in COP28, we've seen that for the first time, there was a 1 day dedicated for health equity as part of the COP28. So such an example we can build on for the future, and to believe that we will continue looking into the opportunities to make sure that we will serve our people and advance well-being of our people here in the region and globally.
Intersecting health equity with climate, health equity with other trends. So,
Exactly.
being that many of these experiments and partnerships are happening here and that emerging technologies are finding a very specific set of applications here, do you expect to see technologies and solutions emerging from this part of the world that then scale to the rest of the globe?
Believe that this will be a practice that not only for you, but for other countries across the globe to learn from. Why we believe that people can learn from UAE? Because if you look at the diversity of the population in the UAE, more than 200 nationalities live in the UAE. This will help that any clinical research that we will run in the UAE will provide a lot of insights for different countries across the globe, because you cannot really find this diversity anywhere else in the world. So I believe that, yes, we believe we're going to build a lot of practices and models in UAE that will help other countries globally to learn from.
It's not just the partnership that's pushing things forward, the data and the use of that data, the solutions that come out of analyzing that data, the training of models on that data. I mean, this is very pioneering stuff.
Exactly.
And when you see the rest of the world, is this happening elsewhere, or is this really, frankly, becoming the experimental platform that can develop these new solutions?
You will really see that there's different initiatives are being run in different parts of the world. It depends on what capabilities and infrastructure you have in a country versus other. But there is still much really to do. We're still like in the initiation phase in unlocking those new trends and technology to advance the healthcare solutions here. So we're among the first tier of the world to start to create examples to learn from for the future.
And since you have that will in the public sector, that partnership with the private sector, we really are going to see how much further things go here than they can anywhere else. Ashraf Mallak, thank you so much. This was fascinating. Thank you for joining us on the Health Beats
My
podcast.
pleasure. Thank you very much, Lara.
Thanks for listening to this episode of the Health Beats podcast. For more healthcare industry news, visit the Abu Dhabi Global Healthcare Week newsletter. The link is in our bio. Thanks for listening. Like, subscribe, and continue to follow Health Beats by Abu Dhabi Global Healthcare Week for your global healthcare industry digest.